Welcome back to our attendees. Our next speaker, Mr. Craig Rhodes, healthcare expert from NVIDIA, speaking on today's topic, the power of HPC computing. Over to you, Craig.
Hello, and thank you very much. Wonderful to be here. So my name's Craig Rhodes. I'm the lead for health and life sciences for NVIDIA. And today, just going to talk about challenges in healthcare as we see it today, how artificial intelligence deployed through HPC is really helping to support those challenges. We'll go through a few use cases and then just discuss how NVIDIA is working in this space as well. So this is a slide I've been presenting for probably the last 20 years. Even today, this is really appropriate, and obviously under the conditions of the pandemic, these are even more important and more challenging that we see, whether it's the increase in patient demands, we're getting older, living longer, multiple chronic conditions, no so more than delivering new drugs. If you look at what we're trying to do with vaccine discovery, and getting that vaccine out, looking at all of the variants that are coming for coronavirus, and ensuring that those variants are tackled by the new vaccines is so important. We're seeing a reduction in the expertise coming into healthcare, as well as that we're seeing an increase in the complexity of these data sets. If you look at imaging in the 2D, 3D, look at things like pathology, the size of the images is enormous, lots of artifacts of interest. Delays in results, the regulation of technology, artificial intelligence is going to be key for the future, but currently it's still held in the kind of regulation as if it was a medical device. Now we have to look at treating the onset of artificial intelligence. We have to comply still to the regulations, the ethics, the governance, but there must be a faster route to getting these tools out to market. And of course, complexity in procurement. Just a bit of background on NVIDIA. NVIDIA's been in this space for kind of over 10 years now. A really kind of change in the way that we approached looking at a vertical. So it's a really interesting area for NVIDIA, but not one, if we look at imaging, not one that we're not good at. If you look at our gaming industry and then transition the gaming industry to medical imaging, we're looking at characters, how those characters are visualized, having high quality imaging, and watching the movement of those characters, and then see that transitioning to medical imaging, looking at 3D, looking at coloration, saturations, and then looking, of course, in the kind of area of artificial intelligence, looking at how we predict disease going forward, look at how we can create synthetic images to start to be able to use in research, whether for things like breast cancer or stroke, really important kind of new areas of healthcare that are becoming, the stable diet of artificial intelligence. So really interesting area coming up. A couple of the things that we're seeing at NVIDIA that are really transforming this market. One is the smart medical device revolution. And so this is really where we're seeing some of the big medical device players like Siemens, GE, Varian, United, and so on. And they're looking at deploying artificial intelligence closer and closer to their device. And then soon we will see that, and we do see that in their device itself. So in the future, will we see MRI scanners that are coming out with recommendations or coming out with guidance rather than just coming out with the image itself and then waiting for the radiologist or waiting for the pathologist to guide and to give that guidance? So really kind of interesting area. The other area is kind of creating minute instruments, so microscopic type instrumentation. So Oxford Nanopore is a fantastic example of this, and we'll talk about that in a minute. This is where we're taking sequencing and shrinking it down to the size of a kind of a mobile phone to enable you to go anywhere in the field to do it. We have other kind of tools that we're seeing as well in the medical device that are becoming much easier, whether they're used by us kind of citizens, and especially when we look at, again, coronavirus, being able to do this en masse as well. So the medical device industry is really, really transforming. The other area that we've seen a big breakthrough is in computational genomics. Now, this is an area of high complexity, lots of data, but data coming at us more and more often, much faster. And genomics is kind of one of the kind of areas for personalized medicine that we're trying to really get hold of and make it really appropriate for the point of care. Currently, lots of big genomic programs around the world, Genomics England. There's one in the UAE as well, looking at sequencing their national population. Really, really complex, not just because you have to sequence all of the population, but then you have to make sense of all of that data. 3 billion base pairs in each human being that then have to be analyzed and then compared to others to identify what the differences are and what the similarities are. And then if we've got a cancer, how to pick that cancer up into that genetic data. So really, really important of what we're doing and how we're doing it in genomics. And one of the things that NVIDIA's been doing is accelerating genomics and really pushing the boundaries of what can be analyzed and how quickly that can be analyzed. This making it more appropriate for when patients come in for particular diseases. And again, if we look at COVID, we have many variations. It's not just a single pathogen. It is mutating all of the time. And we have to understand the mutations, where the mutations are existing, and then how to lock that down and really understand, does the particular vaccine work for this mutation? And when we saw the MERS virus in the Middle East a few years ago, this was one of the key aspects, is to look at the mutations and then track the particular patients that had MERS, where have they been, who they interacted with. Really, really important. And again, we'll talk about a couple more examples. And I described the Oxford Nanopore. It's, as you see here by this person's hand, this is a small sequencer. So this is Oxford Nanopore, a company based out of Oxford, and they've miniaturized sequencing. They do have bigger sequencers as well, but this is really very, very interesting for the sequencing. It's called democratizing sequencing. Being able to take this into the field, being able to sequence plants. In this case, we're sequencing cassava, a root vegetable in sub-Saharan Africa. To be able to determine whitefly, a disease that decimates the harvests. But this is also being used, again, locally by organizations wanting to sequence patients with COVID, but don't have the big labs, the big sterilized labs, the big genomic sequencers, the data centers. You can do this with, it's around about $1,000. You then put in your sample into the flow cell, and there you've got your sequence data starting to produce. NVIDIA is working very closely with Oxford Nanopore on these sequencers and ensuring that the data comes out as fast as possible to be analyzed. So it's just an amazing kind of advancement in this technology, not only to miniaturize it, but also make it accessible across the world to anybody to do anything, anywhere, whether it's food, whether it's animals, whether it's humans, plants, environmental. This little device is really, really important for this new dimension. And I talked about medical imaging, and I just want to talk a little bit about probably one of our biggest programs of work that NVIDIA is doing in Europe and Middle East, and that's in King's College London. King's College London are now partnering with, it's actually 10 NHS trusts, so 10 very large hospitals. They are looking at creating algorithms for oncology, neurology, and cardiology. So looking at diseases like stroke, looking at cancers, looking at cardiovascular disease. They are building these algorithms from those 10 hospitals. This will actually reach, this says 8 million, but it will reach around 26 million patients. This is huge for artificial intelligence. This is huge for patient care, a really important area of where we can try and help to introduce artificial intelligence, not just for research purposes, but really to improve the patient pathway, to help with the clinical teams that are managing these patients, maybe to triage these patients better, maybe to spot artifacts on the images, maybe commonalities from images that have been produced before. One very interesting aspect about King's College London as well is this idea of federated learning. So federated learning enables you to retain the data within the clinical organisation, within the hospital. And we've heard previously around security quite a lot, and that's really key and important. The security of that patient data, but also the ethics and the governance behind that data, the patient allowing that data to be used within their clinical setting, but maybe not in other clinical settings. And what happens here is each hospital builds their own algorithm, let's say for stroke. That algorithm is developed over the time as we get more and more images of the brain produced. So each of those 10 hospitals are producing their own algorithms. At periods of time, we bring together those algorithms, those 10 algorithms, and we consolidate them together to a super algorithm. And in this case, in London, what we get is this demographic population. And, you know, if you look at East London and West London, there's a big split of the demographics of the patients. You know, West London's, we have a lot of people from the Middle East, from Russia, from China. In East London, we've got a very different set of populations. So by bringing the algorithms together, you bring that demographic and you try and lessen that kind of bias that might be in an algorithm if used in one location that hasn't taken that data. The other aspect to this as well is you're keeping the data, the patient data within the hospital as well. You're only moving the algorithm, the knowledge of that particular image. So a really important program, probably one of the most advanced patient programs that we're involved in at the moment at King's. And just wanted to talk about, you know, one of the big important aspects going on here in the world at the moment is drug discovery. NVIDIA announced a partnership with GSK last October, and this is really to help GSK build AI into their drug discovery program. They have a drug discovery lab, again, based in London. This has been used around the world by GSK. And what NVIDIA is trying to do is really kind of help to accelerate the knowledge around artificial intelligence, the tools that can be used against the enormous volumes of data that these big pharmaceutical companies have got. Now, one thing that we heard from GSK was in the first 3 months of last year, they acquired more data than they had acquired in their 300-year history. These are enormous volumes of data. And again, we've heard about storage previously as well. How do you store that amount of data? How do you then go and analyze that amount of data and ultimately make sense of it so you can really do something powerful about that? And again, let's look at COVID. The amount of data that we're collecting, the amount of samples we're collecting, the amount of images of chests that we're collecting. How can we really use these to start looking at the variants of COVID, the change in COVID, and what that might have as an implication into the vaccine? It's a really important part of our own ongoing healthcare is the movement of artificial intelligence into big pharma and how that closes up to the healthcare programs that are going on. So really, why NVIDIA? So, you know, when we look at NVIDIA and what NVIDIA is doing, you know, people might think of the gaming industry, autonomous driving, robotics in manufacturing. But what we've found here at NVIDIA as well, that we are the state of art at healthcare and life sciences, we accelerate some of these workflows and pipelines enormously. So if we just take genomics as an example, we can accelerate the whole genome sequencing from 7 to 8 hours in traditional compute down to around about 30 to 40 minutes. Now, for a few hundred genomes, that might not matter. But when we're looking at programs in the Middle East of 1 million, 2 million population, or in the UK, you know, they're looking at 5 million whole genome sequence across the population. That saving of 7 hours per whole genome is enormous. And then we see that same with things like structure, screening, imaging, as I talked about, both imaging and radiology, but imaging and pathology. It's enormous, the pathology images. Pathology is now becoming one of the big areas, digital pathology areas of focus for NVIDIA, specifically around the areas of multi-omics. So looking at bringing both the genetic data, the pathology data, and the clinical data together to start that kind of personalized medicine or precision medicine world. And then the natural language processing from the big clinical systems. And we've got, NVIDIA's been developing tools, one called Parabricks in the genome space, Biomegatron, a really nice word, around natural language processing in imaging, at the edge, and also in drug discovery. These are all platforms that NVIDIA are building with our partners and starting to deploy out. So really fantastic kind of partner network that we have at NVIDIA. We work very, very closely with them, and some of those partners you've heard from today and what they're doing. So very tight collaboration. This is a complex world that we live in. And we, NVIDIA, we don't know how to do all of this. You know, the clinical teams need to be part of this. The infrastructure, the security, we've heard it again today, need to be part of this. So it's not just an IT problem, this is a clinical problem. And just to kind of finish off, NVIDIA, to show NVIDIA's investment into health and life sciences, we could not kind of show it more than what we're doing here in the UK with COVID, and specifically around what we're calling Cambridge One is a new artificial intelligence supercomputer. And this is a supercomputer that NVIDIA is deploying in London, in the UK. And this consists of 80 of our DGXA 100s. It's the 29th largest supercomputer in the world. And it's the third greenest. So these companies like AstraZeneca and GSK and the NHS are very interested in carbon neutrality. And the first workloads that we will see coming off Cambridge One will include the pharmaceutical teams from AstraZeneca and GSK, the clinical teams from King's College and NHS, and also Oxford Nanopore looking at COVID-19 sequencing. So these are some of the bigger areas, and specifically looking around COVID-19 and trying to support vaccine discovery, trying to support the clinical care of these patients as well. So that really emphasizes the point that NVIDIA is a real serious player in the health and life sciences space, but we have to work through our clinical teams, the drug discovery programs, and the medical devices, as well as all of our partners. Thank you very much. Really appreciate speaking to you all today.
All right, thank you, Craig, for your presentation. We hope to pass on the questions to you from the attendees when we have one.
Thank you.
Thank you.